In this section, we'll cover several USM Elite type questions covering the topics of body fluids, receptors, transporters, neurophysiology, and axonal transport. Question 8. Your long-standing myasthenia gravis patient who has been on acetylcholinesterase inhibitors for many years gets progressively weaker with severe diplopia and shortness of breath, and ultimately gets intubated and placed into an ICU. What might you do next? A. Increase your dose of acetylcholinesterase inhibitor. B. Perform a tensilon test, which means to give a test dose of a short-acting acetylcholinesterase inhibitor. C. Do an EMG. D. Do a muscle biopsy. Or E. Test levels of acetylcholine receptor antibodies. Well, I think it's worth discussing this question a little bit further before we really attempt to answer it. So you have a patient with myasthenia gravis who's on therapy for this, and the patient's gotten worse. Well, there are two possibilities. One is that her disease has simply gotten worse, and she has been undertreated, and that's why she ended up where she is. The other possibility is that for whatever reason, the therapy might be too strong. Either the disease has gone into a form of spontaneous remission, or she may have been placed on another medication which is impairing the breakdown of the medication you've given her for myasthenia gravis. So how can you sort this particular question out, which fundamentally boils down to, does this patient have too much or too little acetylcholine in her system? Well, the most straightforward way of doing this is actually to perform what's called a tensilon test. So tensilon is the brand name of the generic drug edrophonium, and edrophonium is a rapidly acting cholinesterase inhibitor that has a very short half-life. And the point of doing this test is a way of getting a biological assay of how much acetylcholine does this subject have at her neuromuscular junctions. If she has too much acetylcholine, and that was the cause of why she ended up in the ICU, providing tensilon would actually make her worse temporarily. If her disease had gotten worse, and that's what landed her into the ICU, a test dose of tensilon would make her better temporarily. And in the setting of the ICU, somebody who's on a ventilator, making somebody temporarily worse is actually not dangerous because they already are on the ventilator to provide a backup respiratory rate. And the ventilator actually gives you a quantifiable output in terms of whether or not you've been able to increase or decrease this subject's strength. So the tensilon test gives you the ultimate test as to whether or not this subject had gotten worse because of too much or too little acetylcholine. And the rest of these choices here would not have been correct. For example, A, we wouldn't increase her dose of cholinesterase inhibitor because, again, we don't know what the cause of her worsening was. And C, D, and E are not useful tests for somebody who has myasthenia gravis during the course of their disease. It doesn't give you any further information. Question 9. A 70-year-old man with a long tobacco history presents with difficulty walking up the stairs because of weakness. Further history reveals a 20-pound weight loss over the past 3 months, cough, and some difficulty combing his hair. You can order one test. What would give the highest yield? A. A muscle biopsy. B. CT of chest. C. Serum albumin. D. Sputum culture. Or E. Complete blood count. Well, again, I think it's worthwhile deconstructing this question to understand what they're really asking you. One should always notice, in the context of a USMLE exam, whenever a subject has a tobacco history coupled with weight loss and cough, this is usually a very clear indication that you should be highly concerned about lung cancer in this particular patient. And lung cancer, in the context of somebody who has difficulty walking up the stairs because of weakness and difficulty combing their hair, should also trigger a combination of features which would trigger a particular diagnostic category. Whenever somebody has difficulty walking upstairs and difficulty combing their hair, this usually refers to a form of proximal weakness. Proximal weakness, things like weakness in the shoulder girdle and weakness in the thighs and the gluteal regions, is almost always due to a disease of the muscle or disease of the neuromuscular junction. So whenever you are faced with the situation of a coupling of disease of the neuromuscular junction and probable lung cancer, the highest likelihood diagnosis here is going to be Lambert-Eaton myasthenic syndrome. Because recall, Lambert-Eaton myasthenic syndrome is very often a paraneoplastic syndrome. So in the context of this question, and given the opportunity to order a single test, which of these would be the most useful for this particular patient? In some ways, this could be some clinical style or clinical training could be applied here, but a CT up to the chest to understand the ultimate diagnosis here would be very important, because treatment of the underlying malignancy is often the best treatment of the paraneoplastic syndrome. The other choices here, such as muscle biopsy, serum albumin, sputum culture, and CBC, wouldn't lead you anywhere closer to a diagnosis really for either of these two categories, the Lambert-Eaton myasthenic syndrome or the primary lung cancer. Question 10. 23-year-old female, prima grava, 34 weeks pregnant, is found to have hypertension and proteinuria on office screening. She's admitted for observation, then has a generalized tonic-clonic seizure. Magnesium is loaded, but for what reason? A, magnesium increases fetal heart rate variability. B, other anti-seizure drugs can delay delivery. C, magnesium antagonizes calcium, decreasing synaptic transmission. D, other anti-seizure drugs, though better at stopping seizures, are acutely toxic to the fetus. Or E, magnesium protects the kidneys from the rhabdomyolysis produced during the seizure. Again, I think it's worthwhile deconstructing this question. You have a patient who's 23 years old, pregnant, who has hypertension or proteinuria. She has met the definition of having preeclampsia. Once she had a generalized seizure, she now has met the definition of having eclampsia. Magnesium happens to be the best treatment for seizures in the setting of eclampsia. And the reason for this comes from recognition of the importance of calcium in synaptic transmission. Magnesium, being a divalent cation, can antagonize calcium under many physiological conditions, including the role of calcium in synaptic transmission. Therefore, high levels of magnesium will impair synaptic transmission. It does this again by blocking calcium. So somebody who has had a generalized seizure, high levels of magnesium can be used to generally block synaptic transmission. And when you generally block synaptic transmission, this will also block synaptic transmission in areas where you have abnormal synaptic transmission, such as areas of the brain involved in producing this seizure. This happens to be more efficacious than traditional anti-epileptics, such as phenytoin and others, in this particular clinical setting. So the rationale here for utilizing magnesium is C. You're antagonizing calcium and you're decreasing synaptic transmission. This concludes our review of questions covering the topics of body fluids, receptor physiology, transporters, neurophysiology, and axonal transport.